Somatuline Depot is a prescription medicine for adults with a type of cancer known as GEP-NETs that is spread or cannot be removed by surgery, and for the treatment of Carcinoid Syndrome to reduce the need for use of short-acting somatostatin medicine. It is not known if Somatuline Depot is safe and effective in children. Do not take Somatuline Depot if you are allergic to lanreotide. Visit www.somatulinedepot.com/PI for full prescribing information and patient information.
My name's Kerry, and I was diagnosed 3 years ago with GI-NETs. Prior to being diagnosed, life for me was pretty much just a normal life. I went to work, came home, I was beat. I first started experiencing symptoms about probably 7 or 8 years ago. I had pain more in my middle of my stomach. The exercising I used to do, I just didn't do it anymore. I didn't want to leave the house. I've slowed down, there's no doubt about it. I can't do the things at the pace I used to do before. My wife, she wanted me to quit working, and I wanted to quit. I'd be sitting at work, and all of a sudden my entire face would just turn bright red. I thought I was having hot flashes of some kind. I was watching TV and there was a commercial and they mentioned flushing, and that for some reason triggered something in my head that maybe that's what I was having. When you search flushing, the first thing that comes up is Carcinoid Syndrome. My general practitioner ordered a biopsy of my liver and they found that it was carcinoid tumors. Looking back at the various doctor visits, there were definitely some times where I feel that the carcinoid could have been caught much sooner. When symptoms first started showing up for me, I went to my regular physicians and they weren't worried about it. I ended up in the emergency room a couple times and there were some scans done. I think one term the doctor called it some stuff on my liver. There's so many other things that can cause similar symptoms. Advice I would give somebody would be that you have to keep looking and find a doctor that you're comfortable with. You need a rapport with them. You need to treat them as more than a doctor, almost like a friend and a confidant, and they do the same. It's very important that you discuss all the possible treatments. I initially started taking the short-acting medication where I gave myself shots 3 times a day. My doctor recommended Somatuline Depot. Somatuline Depot has helped me greatly reduce the number of short-acting shots I have to give myself. I don't do any short-acting shots in between times. I just go every 28 days. I can leave the house. I don't have to stay here because I'm afraid of not being near a bathroom. I like to cook. I like to work around the house. We have a goal to get out there and see nature and enjoy ourselves. Before we were always on a go, hike, and active, and now we just find other things to do that we've never done.
Important safety information and indications. Do not take Somatuline Depot if you are allergic to lanreotide. Somatuline Depot may cause serious side effects, including gallstones, fatty stool, changes to your blood sugar, high or low blood sugar, slow heart rate, and high blood pressure. Tell your healthcare provider if you have symptoms of gallstones, fatty stool, high or low blood sugar, or slow heart rate. The most common side effects of Somatuline Depot in people with GEP-NETs, stomach area abdominal pain, muscle and joint aches, vomiting, headache, pain, itching, or a lump at the injection site. In people with Carcinoid Syndrome, side effects were generally similar to those commonly seen with GEP-NETs, including headache, dizziness, and muscle spasm. Somatuline Depot may cause dizziness. If this happens, do not drive a car or operate machinery. Tell your HCP right away if you have signs of an allergic reaction after receiving Somatuline Depot. Before taking Somatuline Depot, tell your healthcare provider about all your medical conditions, including if you have diabetes, have gallbladder, heart, thyroid, kidney, or liver problems, are pregnant or breastfeeding, or plan to become pregnant or breastfeed. It is not known if Somatuline Depot will harm your unborn baby or pass into breast milk. You should not breastfeed if you receive Somatuline Depot and for 6 months after your last dose. Somatuline Depot may affect your ability to become pregnant. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Somatuline Depot and other medicines may affect each other by causing side effects or affecting how the medicines work. Especially tell your healthcare provider if you take insulin or other diabetes medicines, a cyclosporine, or medicines that lower your heart rate, such as beta blockers. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Somatuline Depot. To report suspected adverse reactions, contact Ipsen Biopharmaceuticals, Inc. at 1-855-463-5127 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. For more information, ask your healthcare provider and visit www.somatulinedepot.com/PI for the full prescribing information and patient information.